Hello, I'm Dr. Sunil Kumar, PV, attending consultant, Fortis Hospital Bannerghatta Road. I'm going to talk about Urodynamic study. Urodynamic study is a study to assess functioning of lower urinary tract, especially bladder and urethra down, by assessing the pressure and flow altogether. So this is a special study which we do in OPD basis, where we insert smaller pipes in the urinary passage to fill the bladder and assess the pressure from the bladder and pressure of the abdomen. It is indicated in cases where there is difficulty in passing urine and cause is unknown, and to ascertain whether surgery is indicated or not. So it is a combination of three things. We'll measure the uroflow as a part of it, where we'll see the speed with which patient is passing urine, and we'll assess how much urine is left behind us, which is known as post-void residue urine. And we do cystometry, where while filling we'll see if there are any unnecessary pressures which are developed in the bladder. With pressure, how good patient is able to void it out. This is indicated in elderly patients to differentiate whether there is a problem in the bladder pressure, or down the line in the urethra whether any obstruction is there, or in patients with benign prostatic hyperplasia with Parkinsonism, to make sure whether the procedure is going to help them. And especially useful in pediatric patients who has suspected urogenic bladder, where voiding is difficult and we have to ascertain whether bladder pressures are more causing some kidney damage. So there are particular indications. We need to have a question for which urodynamic study will give an answer. Although it is slightly invasive, where we are putting catheters in the bladder and rectum, the procedure will take at least an hour's time, and we'll do it under antibiotic coverage. It's quite safe and very useful test to ascertain any procedure is required prior. Thank you.